Hello everyone, my name is Alexandra Mikoska. I'm a scientific officer team leader in hematology at Hornsby Ku-ring-gai Hospital in New South Wales. I'm presenting a project today that is titled Enhancing Patient Safety and Data Integrity. It's a comprehensive improvement project for sample collection in the emergency department and reduction in workload due to pre-analytical sample errors in the pathology laboratory at Hornsby. So this project is about the high incidence of errors in the sample correction process, ranging from mislabeling to sample mix-ups that not only jeopardize patient safety but also compromise the integrity of healthcare data. The aim of the project is to comprehensively understand and mitigate these challenges by involving a diverse team of healthcare professionals from various disciplines. These challenges not only impact patient well-being but also have broader implications for healthcare data and financial costs. The problem is high incidence of errors in the sample collection process within the multidisciplinary laboratory at Hornsby. This problem directly impacts patient safety and the quality of care. The errors in sample collection can lead to incorrect diagnosis, potentially harmful treatments, and patient distress. The scope of the problem includes errors in sample labeling, sample mix-ups, inadequate sample handling, and documentation errors, and all of that can have serious consequences for patients. Sample collection errors affect the integrity of healthcare data. Inaccurate test results can propagate through medical records, affecting ongoing patient care decisions and patient outcomes. This is the total key findings for the month of September at Hornsby Ku-ring-gai Hospital. The key finding was laboratory audible called KIMS, and it's ordered every single time a patient's result testing has to be cancelled, and it's done through the laboratory information system. We have a way of getting this data through extended searches. So for the total amount of samples for the month was 12,000, around that mark, and there was out of there, all of them was 249 samples were sampling had to be cancelled. And this is the breakdown by ward in the hospital. As you can see, the largest number of errors was coming from ED, and it was a total of 128. Um, Out of the total KIMS audibles, the cumulative KIMS, so majority belongs to emergency department, and the rest belongs to the all the other departments. Out of all the samples, KIMS that belong to emergency department, it was a sort of equal disbursement of different types of issues, and there was one side is unsuitable specimens, so samples were not collected in the right tube, they were underfilled, they were clotted, wrong patient collected. These are some of the most common issues. And then the other side is the data entry issues, so they were not there wasn't the request form wasn't sent with the patient. There was no labeling, suitable labeling of the specimen. There was tests that were missed. Um, a data entry point. So what's the key issues with the pre-analytical sample errors? We're putting the patient's safety at risk. That was the number one issue. Patient comes first. Second is the compromised data integrity. Sample collection errors have far-reaching consequences for healthcare data. Increased costs. So every time we retest, we have increased the cost of testing. And then we have other issues like staff morale and burnout. So we keep asking staff to recollect would cause burnout to the staff. It's quite stressful, especially in the very stressful environment of emergency department. Then we have regulatory compliance issues, where the patient with the non-compliance would cause lose of accreditation. Then we have the patient experience. Patient will have to be recollected, and they will not be happy about it having that procedure again. It can be invasive, can be quite stressful, especially for patients that are very ill or they're underage. Then we have the problem as such as reputation and trust. So if there's a lot of these sample errors, it damages the reputations of the Hornsby Emergency Department. The project objective is to reduce the high rate of sample collection errors. We have so how we're going to achieve that is through enhancing patient safety and quality of care, improving the integrity and accuracy of healthcare data, minimizing the financial burden associated with testing and follow-up procedures, mitigating stress and burnout among healthcare professionals, ensuring regulatory compliance and preventing legal accreditation challenges, elevating the overall patient experience and satisfaction, rebuilding the reputation of Hornsby Emergency Department, re-establishing trust in the institution. So there was a design details of this project was quite complex. The data collection was complex, especially because it involved multiple disciplines of healthcare professionals that are involved in the sample collection process. So there was a quite of it's a sensitive topic, especially for the high stressful environment that is in emergency department. Um, and there was a lot of apprehensiveness when staff were being approached. They quite most of the time didn't want to comment, or then they would take it very personally. So it was quite delicate how I had to approach talking to the staff. Um, but they had to be involved. They had to be presented with the problem and how it is um, accepted is one thing, but the other thing is that the problem is there and needs to be solved. The process mapping is so how we're gonna develop the process is through involvement from various healthcare disciplines. Tailoring the training programs to address the distinct challenges and needs of the laboratory staff, nurses, and emergency department physicians wasn't easy, especially because there's so many disciplines involved. Um, it was quite complex to involve all these disciplines and get them to develop this training methods, passing on the information, the doctors, the new staff, they arrive, constant change of staff. Um, training the nursing staff will fall under the responsibility of the NUM. Then there will be involvement from the head of emergency department as well as the laboratory manager at Hornsby Hospital. There could be potentially involvement from collection staff, so it's quite a mix of people. And the communication needs to go between all these heads of departments, and then it has to be disseminated to the staff that do the blood collections. Um, so we understand that in emergency situations, there's quite a large error rate, but also in those situations, as when the most critical collections happen is when we have to cancel a patient's blood for testing, and that's quite significant. The other suggestion was to roll out a pilot testing, and just to see how that would work and work out any nicks to see if there's any issues and if they can be escalated and improved. That's where the feedback comes from the actual staff performing the collections, and then we will move on to full-scale implementation. The value strategy is to measure the outcomes. So that would be ideally decreasing the number of incident reports related to sample collections. Um, Then we will have improved satisfaction scores related to the sample collection process. And this should account for the unique experiences, expectations of laboratory staff, nurses, emergency department physicians, and so forth. We also have to be meticulous in data collection and monitoring the data after we roll out this project. Translation to the healthcare setting should be in two stages. One is sustainability plan, so ongoing training support programs tailored to meet the evolving needs of laboratory staff, nurses, and so forth. Periodic audits to make sure these procedures are being followed, and we should be implementing a feedback mechanism where the staff will inform the people responsible of any issues and any improvements. So then the other party will be the knowledge transfer, and that will be done through continuous learning and continuous quality improvement. In conclusion, the sample collection errors can lead to multidisciplinary issues across the whole healthcare team looking after the patient. We have an emphasis on patient satisfaction and to reduce the cost of retesting, training, communication, and sharing of knowledge gained amongst multidisciplinary healthcare providers. Thank you.